Ladies and gentlemen, good morning. My name is Christopher Colbert. I am the chair of CME for the American College of Osteopathic Emergency Physicians. I'm also one of the co-moderators for our fall virtual conference held October the 11th to the 14th. Now, we have an amazing lineup of great physicians for this conference. And in fact, I've got one of the amazing presenters here with me today, one of the juggernauts of Foam Med. We all know him with Rebel EM. Ladies and gentlemen, Dr. Salim Rezaie. Salim, how are you doing?
Doing great, Chris. How are you guys doing?
I'm doing well, doing well.
Nice.
It's nice to have one of these interviews and just wear the comfortable t-shirts. Thank you very much. I feel comfortable with this.
Hey,
Thanks
man.
a lot.
I mean, you got the Superman thing going on. I got the Counting Crows thing going on. I mean, what more could you ask for?
I like it. I like it a lot. Please provide a little bit of insight. What are you going to discuss for us in the fall?
So I actually have two talks I'm going to be giving, and it's really a two-parter. It's like a part one and a part two. And I'm hopefully going to be kind of spreading some knowledge about COVID-19. I've actually been working in the emergency department and the ICU. And so I've been getting to see these patients on both sides, both downstairs and upstairs. And I really broke it into two parts. And the first part's going to be just kind of the practical things, the things that have like good evidence behind them. So like when to change practice, how to reuse our N95s, dexamethasone, remdesivir, and convalescent plasma. So I think these are the things that have better evidence base to support them. And then in part two, we're going to start getting a little controversial. We're going to talk about anticoagulation. We're going to be talking about awake proning, about trying not to intubate these patients too early, ECMO, and then how can you give a talk on COVID-19 updates without talking about the debacle of hydroxychloroquine? So I think that's going to be the 10 things we're going to try and tackle in two parts, and I hope people enjoy it.
Looking forward to it. It sounds great. Sounds really great. Now, final question for you, Salim. Our viewers want to know. You're stranded on an island and you can only have 3 restaurants deliver food to your island for 3 months. What would those restaurants be?
So Chris, diet has been a huge part of my life over the last 3 years. For people who don't know, I've lost 60 pounds over the last 3 years. I used to be what I like to call festively plump. And so I'm really picky about my food. And so I have 3 restaurants. I can already tell you what they are. One of them is called Salata. I don't know if people are familiar with that, but it's like a basically salad buffet. Like anything you would imagine on a salad, they have it available. So can you imagine just having fresh salad like every day? Like that would be amazing. The second one is a restaurant called Pasha, which is a Middle Eastern restaurant. For people who don't know, obviously my name gives it away, but I'm Iranian. And so how can you not have your own ethnic food delivered to your island? So Pasha would be number 2. And then there's a third one called Farm Table, P-H-A-R-M, P-H-A-R-M, farm. So not like F-A-R-M. And the reason I love this restaurant is all their food is organic, it's seasonal, and they give you like a basic variety of all the different healthy options that you would want. So I think I would be completely ecstatic with those 3 if they could just deliver to me, like just Grubhub and just, drone drop it in for me. So it'd be great.
I like that, ladies and gentlemen. Organic food, topics of COVID. There's a lot we can learn from this guy. A lot we can learn. We're really excited for you to participate within and just give these amazing lectures with ACOEP. Thank you very much, Salim.
Thanks for having me, guys. I always appreciate the invitation and love supporting ACOEP. Thank you so much, Chris.
Yeah, I appreciate it.